on insulin, and within a month, all three of them were off of all their insulin. And they'd been on the insulin for like 20 years, right? So 20 years, they got off in a month. So calories are a distraction because the body doesn't look at calories. The body looks at hormones.
Jason, I want to start our conversation giving people hope. And this is for people out there that are suffering from obesity, prediabetes, or type 2 diabetes. So by the end of our conversation, we're going to give people an education of how they can treat these conditions naturally.
Yeah, I think that the most important thing to understand is that these are reversible conditions. So for many, many years, in fact, all the diabetes associations had said explicitly that type 2 diabetes was a chronic and progressive disease. So what it means, of course, is that you can't reverse it. That's what they're telling people. And the funny part was that even as they said this, everybody knew it was just a big lie. If you lost weight, the type 2 diabetes usually got way better or went away completely. So it was obvious that it was reversible. We just weren't hitting the right things. And what had happened, I think, is that the doctors had been just giving tons of drugs for these conditions, not understanding that it was a dietary lifestyle disease. So then when they gave the drugs and things got worse, they said, well, there's two options, right? The doctors could either believe that they were giving the wrong treatment, or they could believe that they're giving the right treatment, but that this is just the way the disease goes. And of course, doctors don't want to blame themselves saying, oh, we don't understand this. So they said, well, this is just the way the disease is. Even though the evidence for that was clearly that this was a reversible disease. So essentially, the doctors had been lying to themselves, trying to explain their failure to control this disease by saying this was a progressive disease. And in fact, it wasn't, which is actually great news, because if it's a reversible disease, then you just have to understand what it is that is most important to focus on so that you can reverse the disease. Now, it's not easy. It's not fun, but it can be done. That's the point.
I think it's important, before we get into some of these tools we're going to use to reverse the conditions, we get into how the condition comes upon us. So let's take from a typical healthy individual who's regular weight, and let's progress through what happens as somebody gains weight all the way to type 2 diabetes on the other end of the continuum.
Yeah, so essentially the way to understand it is that these are all diseases of hyperinsulinemia. So what insulin is it's a natural hormone that is released, and it's a nutrient sensor. That is, when your body takes in nutrients, then insulin goes up and your body stores some of those nutrients away. If you are eating foods that sort of stimulate too much insulin, then you're going to get into a situation where you're storing too much, right? And that's what obesity is. So it's the question is, what's causing this sort of excessive increase in insulin? And to a large extent, it's likely the foods that we eat, which are much more highly processed than before. And also the way that we eat it, which is that we eat it sort of constantly. The availability of food is much more, and we've been told again and again to eat all the time, or never skip breakfast, and eat 6 times a day, eat 10 times a day. Well, those are not natural ways that humans in the past had been eating. We never ate the minute you get up to the minute you go to bed. You eat sort of in a discrete period of time, and then you don't eat for a discrete period of time because there's work to be done. So the idea is that in nature, there's a lot of sort of checks and balances. In the human body there is. So why did we get to this state where we became obese, where we developed hyperinsulinemia, which became obese? And it's in large part due to the hormones. So you have to understand that when you eat, you store some of these foods, but then you get full, right? So there are satiety hormones. And there are foods that, while they make you store some of these hormones, they also tell you to stop eating. So you go to a buffet. It's not like you can continuously eat, because at some point you're just going to be, I'm so full. So proteins, for example, will release peptide YY, which is going to stop you from eating. So even as you're eating, you're releasing the hormones that are going to stop you from eating. If you eat fats, you're going to release cholecystokinin. If you eat unprocessed carbohydrates, carbohydrates, you're going to eat sort of bulky foods. Because remember, carbohydrates, which are chains of glucose, generally in nature, in their natural form, come with a lot of fiber in them. So they tend to be bulky. So grains, if they're not processed grains, are pretty bulky. Beans have a lot of fiber. Fruits have a lot of fiber. So even as you eat them, your stomach actually gets stretched out. And as it gets stretched out, it's going to tell you, again, stop eating, so that you cannot continuously eat all the time. As you start to process these foods, you're going to start to sort of bypass some of these protective mechanisms. So you take grains, for example. Now you strip out all the protein, right? So when you turn that wheat into flour, what you're doing is you're taking out all the fat, you're taking out all the fiber, and you're taking out all the proteins, and being left with white flour, which is essentially pure carbohydrate, which never goes bad, of course. Like if you can keep flour in your pantry for a year and a half, it's fine. It never goes bad because there's no, say, fat in it, which might go rancid. And there's nothing else that's going to go bad. So it's a pure carbohydrate. And when that happens, of course, then when you eat those foods made from the flour, then you're not going to activate any of the satiety mechanisms. You're not going to have protein, you're not going to have fat, and you're not going to have the stretch of the stomach. So therefore, if you're eating this sort of pure carbohydrate, it's extremely difficult to know when to stop because you don't know when to stop. So if you eat a full buffet, you cannot go out and eat another pork chop. You're going to be like, oh, that's going to make me nauseous. Remember, that's the same pork chop you happily ate, half an hour ago. But the hormonal changes said that you're now full. However, you could eat a cookie because it's all pure carbohydrate. There's no satiety. You could drink a Coca-Cola because, again, there's lots of calories. So calories are a distraction because the body doesn't look at calories. The body looks at hormones. If you're completely full, you could still drink a big glass of soda, which might have 500 calories with a lot of sugar because there's no satiety. So this is the problem. As we switched over in the 70s, we told people to eat very low-fat foods. And the other mistake was that we told people, the government actually encouraged companies to make a lot of processed foods because we believe that those processed foods would be healthier for us than natural foods, right? It sounds crazy to think that, right? Why would a government think that processed food is better than natural food? Well, remember at the time, we also thought that artificial breast milk, that is baby formula, was better than human breast milk, right? There was this idea that human stuff was just terrible. And, my mother tells me that at the time, only poor people breastfed their children, right? And again, sounds crazy now, but there's an entire campaign called Breast is Best that was focused on people going back to breastfeeding as the best form, which sounds completely stupid. Like, how can people be so stupid? Yeah, but everybody believed it at the time. Just like we believe that those processed foods that stripped away all the fat and all the natural characters of that food would be better for us. So that set us up for a sort of epidemic, because everybody believed it at the time, of excessive insulin because we're eating foods we don't know when to stop, so we kept eating them. Well, that's going to lead to increase in insulin, which is going to store all those calories. You're going to get obesity. As you get obese, you're storing away all this food. You keep storing it. At some point, you can't store anymore. And remember, carbohydrates are chains of glucose, so then blood glucose goes up, which led to type 2 diabetes. So the whole process, which happened through the 70s, which was born out of this sort of misguided idea. So in the 70s, that fat was bad for you. So remember, people thought that avocados were bad for you. They thought that olive oil was bad for you. They thought that nuts were bad for you, all of which we know are not really true. They thought that eggs were bad for you, right? There's all kinds of hysteria about natural fats, which I think was as misguided as the hysteria against human breast milk. But that's what happened. So then you got this hyperinsulinemia. developed obesity, which was one of the diseases of hyperinsulinemia. And then as you go further along, you started to see the type 2 diabetes.
Let's get deeper into the physiology of what happens when we consume carbs. You got into this a little bit, but let's take it right from when carbs enter the body, they go into our digestion. What happens after that?
So carbohydrates, so remember there's three major macronutrients in the body. So there's in foods. So all foods are sort of contain varying amounts of carbohydrates, proteins, and fats. Those are the macronutrients. So carbohydrates are chains of glucose. Proteins are chains of amino acid, and fats are fatty acids. Okay, so those are the component parts, and carbs, proteins, and fats are simply sort of long chains or conglomerations of these different macronutrients. So they're all processed differently. So carbohydrates are glucose. When you eat them, your body absorbs this glucose. As you absorb the glucose, the blood glucose goes up and insulin also goes up. As insulin goes up, it takes this glucose and lets the cell use that for energy. And any excess, because when you're eating, you're taking more energy than you need at that specific point in time, then your body is going to store some of that energy. And you store energy in the form of glycogen. So glycogen is glucose. So you take the glucose in the carbohydrate, which is arranged in two major forms, amylopectin and amylose, breaks it into glucose, which are sort of molecules, individual sort of components. And then you restring it into this long chain called glycogen, which is stored in the liver. And if you don't eat, so when you go to sleep and you don't eat, well, your body then takes that glycogen, chops it back up into glucose, sends it back into the blood, and there, you don't die. So if you didn't have that ability, of course, then you wouldn't have any energy. You'd have to constantly eat. But we do have that ability, which is the reason that you do not need to constantly eat. Fats are quite different. So if you eat fat, then you take the fatty acid, it actually just goes straight into your fat stores. If your body has stored glycogen and now the storage is full, you can store enough for about 24 hours of energy. And after that, you activate something called de novo lipogenesis, which is where you take the glucose and you turn it into fat. Because again, it's just a storage form of energy. The glycogen is very easy to get at, but it's very limited in capacity. So if you're eating huge amounts of carbohydrate, and remember at the time, we told people to eat all carbohydrate, right? We said 60% of the diet should be carbohydrates. So therefore, if you're eating too much of that, then it's going to get turned into fat. You get fatty liver, because that's where you get the de novo lipogenesis. So you get big fatty liver. As you get fat in the liver, the liver doesn't want that fat. It wants to get rid of that fat. So then you get rid of it by exporting some of this fat out. You get this abdominal obesity. The other thing that you start to see is that as it exports it out, your triglycerides tend to go up because that's the way that the liver gets rid of fat, and your HDL goes down. So increased triglycerides, decreased HDL, those are two of the key components that you see in metabolic syndrome, which is part and parcel of type 2 diabetes. And that's sort of how you do it. There is a big difference between sort of processed carbohydrates like white flour and unprocessed. So remember, white flour is sort of got all the proteins taken out, all the fats taken out. So it's pure carbohydrate, but even more importantly, I think, is that it's ground into a very, very fine dust. So if you take flour and you throw it up, right, it disperses because the particles are just so fine. When that happens, of course, the absorption of that glucose is extremely fast. So just same reason why people grind up, powders like cocaine, because they can absorb it and get that big spike. What happens when you grind up the flour into very, very fine dust is that you get a very, very huge spike in glucose and a huge spike in insulin. When you get that huge spike, all that energy, so remember, insulin tells your body to store energy. So if you get a huge spike of insulin, all of that energy is going to go into storage. So say you eat 500 calories, you eat white bread and jam, and boom, you get a huge spike of insulin. You get a huge spike of glucose. But all of that's going to go into storage. So if all 500 goes into your liver, well, what's left for the rest of your body to use? Well, there's nothing. So in fact, what you see sometimes is that the glucose falls very low and people actually get hypoglycemic. So as you get this huge spike up, all of it gets stored, goes straight down because of all the insulin, then you want to eat again, right? So what happens, of course, from a practical standpoint is that when you eat breakfast and you're just eating white bread and jam and no proteins and no fats, because that's what the government told us to do, right? Eat low fat. Then what happens is that at 8 o'clock you eat breakfast, at 10:30 you're looking around for something to eat. So you're like, I need a muffin, low-fat muffin, right? And then you're just, because you're ravenous. Whereas before, when you ate 2 eggs and bacon, that stuff just stuck around all day, so that you're fine until like lunchtime, 12 o'clock, as opposed to being hungry at 10:30. So now all of a sudden, people are eating ultra low-fat, ultra-processed foods, and they're like, okay, but when I eat, I'm ravenous by 10:30. Then I get a snack, I eat lunch, then I'm ravenous by 2:30. I get a snack, and then I eat dinner, and then I'm ravenous again before breakfast, before bed, and then I'm going to go get a snack again. So all of a sudden, you're eating 6 times a day. So people started to look at this and say, I'm eating 6 times a day, but I'm really eating really healthy because I'm eating all bread and, there's no fat. And, I'm eating jam and, it's like, okay, well, one, it wasn't that healthy. It was just that the government told us that. And two, they said, then this must be the right way to eat. You have to eat 6 times a day. That's the only way you can eat ultra low fat. Again, recognizing that this was also ultra processed, but of course people didn't recognize that at the time. So that's sort of how it goes. You wind up eating all the time. You wind up getting these big spikes of glucose, which lead to these big spikes of insulin, which leads to all of that energy just getting stored away. And therefore, you must go out and eat again because now you're hungry. So people aren't, didn't have low willpower. And we said, oh, they have no willpower. It's like, no, the way they're eating is just leaving them hungry all the time. Like, it's just common sense. If you eat like just bread and jam in the morning, you're going to be hungry. If you eat eggs and steak and eggs, you're not going to need to eat till 12, but probably not till like 2 because you're just so full from what you ate. So again, remember, steak and eggs are going to have fat, which is going to create cholecystokinin, which is going to stimulate peptide YY, which is going to keep you full. So, that's sort of how the physiology worked. And it's like people always think it's all about calories. Calories enters nowhere in this. Because remember, by the time you take your calories, your body can either use it or store it. When you take those 500 calories of white bread and jam or cereal or something like that, all of that immediately goes into storage. You have nothing left, right? It doesn't break any energy balance equations. It's just that all of it went into storage.
I want to come back to that piece of overwhelming the liver. So if we take in too many carbohydrates or too much glucose at once, you mentioned this before, that what the liver is going to do is store that if there's room in the liver as glycogen. But as that becomes full, and again, I'm just highlighting what you said before because I think this is a really important piece for people to grasp. Then the liver becomes fatty. It's trying to get rid of the fat and start sending it out into other areas of the body. So the first thing to get fatty is the liver, and then as it's trying to clear the fat, the rest of the body takes on this fat. Which, when it comes to type 2 diabetes, this is when the pancreas ends up taking on too much fat, and then it doesn't function correctly. So let's take that and talk about that piece where the liver's become fatty, it's exporting the fat throughout the body, the pancreas actually starts to take on fat and become fatty, and then it doesn't function well.
Yeah, exactly. So as the liver kind of gets too much fat, it's not a place that is supposed to store fat. So it gets rid of it, and then you get this abdominal fat. So all the fat around the abdomen gets fat. So you see this actually because these people with diabetes and metabolic syndrome, they could actually be fairly skinny otherwise, but they have a big belly because all the fat is concentrated in that belly. And that's why in the metabolic syndrome, one of the criteria is not weight or body mass index, BMI. It's actually waist circumference because all of that fat that gets stored. So even if your BMI is perfect, if you have a big belly, that means you have too much abdominal fat. And that's because of that fatty liver that's kicking out. Then the next thing is that the pancreas also takes on some of this fat, as does everything else. And the thing is that it's also a protective mechanism, because what happens over time, of course, is that as you're taking in so much carbohydrate, you're spiking your insulin so much, the pancreas produces this insulin. So if the fat starts to clog up the pancreas, eventually what happens is that the insulin levels, which are very high, get lowered a little bit, because the pancreas simply is blocked by this fat. And as it gets lowered a little bit, the blood glucose sort of spikes up, and that actually, that's when you get diagnosed with type 2 diabetes. But in fact, it's actually the body's way to protect itself, because as the blood glucose starts to go up, what happens is that the blood glucose gets filtered in the kidney, and you start urinating out some of this glucose, which is what leads to the symptoms, which is, excessive urination. And that's all this excessive glucose that you're peeing it out. But if you see from the ultimate cause, so if you consider that the real cause of type 2 diabetes is that you're really taking in too much glucose or sugar, now with this whole process, when it gets to the sort of later stage, your body has responded by peeing out some of this sugar, which is, of course, makes sense. That's going to make it protective. And that's why these things happen the way they do. They're not by accident. The body's actually trying to protect itself against this excessive glucose load by peeing it out. But the only way it can do that is to allow that insulin levels to fall a little bit down, so that it gets the blood glucose goes up. So everything's a balance there. But yeah, you get this fatty liver, you get this fatty pancreas. And when people saw that the pancreas was starting to go down, they said, well, the pancreas is starting to fail. This is like type 1 diabetes, and that's why this is a chronic and progressive disease. But they were wrong, because the pancreas, as you lose weight and get rid of some of this pancreatic fat, actually recovers. So therefore, it wasn't scarred up. It was just sort of clogged with fat, which means you could unclog it, right? If you're saying that the pancreas is working so hard and it's producing so much insulin that it's burning out, you can't reverse a burned out pancreas. But if it's simply clogged with fat, you can unclog it. And that's the point. So there've been now a number of studies where people simply do something such as, and for the most part, they've been fairly drastic sort of diets and bariatric surgery. You can actually show that the pancreatic function starts to recover.
Lucky for us, and this comes back to how we opened up talking about hope, you can really, over a lot of years, abuse the body, and then taking on some of these different tools that we're going to share coming up, you can reverse it, which is just, we're just so lucky that our body is that resilient.
Exactly. And it's really sort of decades of poor nutrition. And people, they always blame people for this. Like, people always say, oh, that's because, you didn't eat healthy, or that. It's like, well, no, it really came down to the government sort of making these proclamations that you should eat low fat, that's the way you're going to be healthy, without much scientific evidence, actually. And then pushing through this, idea that wasn't quite right to begin with, and that's what we're paying the price for. Same as, when people said, oh, breast milk is not as good as formula. Then you push through this idea, which had no scientific backing, and that was mostly through the companies, of course. You push through this agenda, and it just had bad consequences.
Up until this point, we've been talking about overconsumption of glucose, carbohydrates, and how that ends up clogging up the body. But an important other stream that we need to talk about is fructose coming in the body. And this substance is found primarily in processed foods and soft drinks. And it basically is an accelerator on fattening up the liver. So let's talk about how this fits into the whole picture.
Yeah, so fructose is an extremely important part of the whole discussion, because fructose is also a sugar. So glucose is a sugar, fructose is a sugar, but the way that they get metabolized is extremely different. So fructose is found in fruit primarily, and also things like high fructose corn syrup, of course, have a lot of fructose in it. So when people were worried about fat, so 70s, 80s, 90s, It was all about fat. Fat was bad in all its forms. Nuts were bad, olive oil was bad. Nobody ate avocados because that was just bad. So people believe that low fat was so bad for you. So therefore, sugar got sort of a free pass, even though it never really should have. Everybody knows sugar in excess was bad. They've known that for a long, long time. But because the focus now switched to dietary fat, people sort of relax on the sugar. So sucrose, which is table sugar, is composed of one molecule of glucose and one molecule of fructose. So when you eat carbohydrates like rice and potatoes and bread, there's no fructose in it. They're pretty much 100% chains of glucose. When you eat table sugar, it's sort of one glucose and one fructose. You can eat pure fructose, for example. You can eat fructose like high fructose corn syrup, which is sort of enriched in fructose. So when people looked at it, they said, well, first of all, the glycemic index of fructose is very low. That is, if you look at the blood glucose, when we talk about blood sugar, it's blood glucose. So if you eat glucose, your blood glucose goes up. If you eat fructose, your blood glucose doesn't go up because it's the fructose that's going up, not your glucose. So people actually thought this was actually extremely healthy for you. Through the 80s and 90s, people thought fructose was terrific. So high fructose corn syrup, terrific. It's sweet, doesn't raise your glycemic index, and it's low in fat. So what could be better? So of course, everybody's just pouring fructose into their diet through high fructose corn syrup. And it turns out that that was a really bad idea because of the way it's metabolized. So glucose is used by all cells of the body. So your heart, your liver, your kidneys, all of it uses glucose. So you eat bread, for example, you get a big slug of glucose, but all of your body is using it. So if you weigh 180 pounds, 180 pounds of your body is using glucose. When you eat the same amount of fructose, none of your cells can use it. It actually all goes straight into your liver because that's the only organ that can actually metabolize fructose. So instead of 180 pounds of body using glucose, you've got like 5 pounds of liver metabolizing this fructose. So what happens to the fructose? Well, you can turn it into glucose, but if you're eating table sugar where you've got lots of glucose and lots of fructose, your body doesn't need more glucose. So it takes this fructose and it turns it straight into liver fat. So now you've accelerated that process of fatty liver, which is going to lead to abdominal obesity, which is going to lead to high blood sugars, which is going to lead to hyperinsulinemia, fatty pancreas, the whole works. So therefore, sugar is actually sort of extremely bad just in the way it's metabolized because your body can't burn it off to the same degree. You're sort of bypassing the normal process where your lungs and your heart are burning off glucose. The fructose bypasses that entire sort of usage point and goes straight into the liver and just turns straight into sort of liver fat, which is the most dangerous fat you have. So that's why as we went low fat in the 70s, 80s, and 90s, sugar, consumption increased so much, and people had recognized pretty well by this point that really cutting out sugars is probably one of the most important things. I don't think anybody disagrees on that.
For somebody tuning in and they feel like up until this point, I haven't been really conscious of how many carbohydrates I've been consuming and how much sugar, we talked about the waist being a measurement around the waist being a sign that you're accumulating that visceral fat. How does somebody go about, is that the best way somebody can go about assessing where they are along this continuum of, obesity, prediabetes, diabetes? Subjectively, and then let's talk about some of the objective tests that people can have done to see where they are.
Yeah, so waist circumference is really the most important measure of sort of metabolic health that's easily available anyway. Like you can gauge your weight, which is body mass index, but it's quite inaccurate because body weight, of course, depends on muscle, depends on bones, depends on all kinds of things. So as you lose muscle, for example, you lose weight, but that's not a good weight loss. You can do body fat, but that's not so easy to measure accurately. Whereas the waist circumference, you just take tape measure, you put it around your waist, and that's it. You want your waist to be about half of your height or less, and that's the ideal sort of amount. So if you're 6 feet tall, that's like 72 inches, for example, and you take half of that, and that's sort of your ideal waist size. So that would be around a 36, for example. So you can use it for whatever height. And that's just a good sort of, rule of thumb. You want to be less than half. And the more you are above that, the more risk you're going to take with metabolic health, because you know that you're getting this abdominal obesity.
And when it comes to testing you can have done through the blood, is that worthwhile? And what tests should people look at?
Yeah, so testing through the blood, there's a few different tests that are sort of standard. So the one that people generally use for the sugar is the A1C. So that's a sort of 3-month average of sugars. And you want to be under 6.0 is defined as non-diabetic. Now, there's actually better ways so when you look at metabolic health, there's a definition of metabolic syndrome, which is actually comprised of 5 different things. And you can do this all yourself. So we talked about abdominal obesity. So you look at waist to height ratio. You look at blood glucose. So that's the hemoglobin A1C, which is a standard blood test, but you don't have to even do that nowadays. There's actually better technology than that. So you can use continuous glucose monitors. And these are monitors. So the old way was to get those things that you prick your finger and you check your blood glucose, you can check, but there's better ways now. So the continuous glucose monitor is a sensor that sort of goes into your shoulder or in the back of your arm, and it's a little disc like this, and it stays in for 2 weeks, and it will measure your blood glucose every so often and give you sort of an estimate of what your A1C is going to be. So rather than waiting for 3 months and having to go to your doctor and go to the lab and get it tested, then go back to your doctor and see what your result is, you don't need to do all that. You can just get one of these. They're kind of expensive these days. That's the main drawback. So that's the abdominal obesity. So metabolic syndrome is the abdominal obesity, blood glucose, blood pressure, and you can get that checked pretty much in any pharmacy these days. They have home measures, which are very accurate. And then the triglycerides and HDL. Those are the 5 components of the metabolic syndrome. So that's just standard blood work as well, triglycerides and HDL, because as your triglycerides goes up, remember that's your liver trying to get rid of all the fat by putting it out in these molecules called VLDL, which are very triglyceride rich. So when you measure triglycerides, they tend to go up. When triglycerides go up, HDL, which is your good cholesterol, tends to go down. So they actually go together. And so those are the 5 components. They're all easily available. They're all sort of standard blood tests or other measures that are sort of easily available.
And then what about testing specifically for insulin and seeing what that level is? Because a big part of the picture here, what I'm sure people are starting to grasp, is that conventional medicine, they've been looking at blood glucose and putting all their focus there, where that's just a symptom. What we really need to focus on is insulin and the effect that this is having when it's raised in the body. And that's what's at the heart of this whole diabetes disease.
Yeah, exactly. And the measures of blood glucose are not as useful as you might expect because they're so variable. So if you eat or if you don't eat, your blood insulin is going up and down like this. Just like when you do a random blood glucose, right? You test it once. It could be high, it could be low, but it's going like this throughout the entire day. Up and down, up and down, up and down. What you really want to know is sort of the average over time, and we don't have that same measure for insulin. And that's why we have to use glucose. The reason why people focused on blood glucose and that was sort of incorrect is that, remember, the blood glucose only reflects the compartment of your blood. It doesn't reflect what's going on in your body, right? Your body has this huge capacity for storage. And if you're only looking at the blood, well, you don't have no idea what's happening with the rest of your body. Is your body stored too much glucose, or has it not stored too much glucose, right? It's like sort of like saying, looking at what's on your table for dinner, it doesn't tell you anything about what you have stored. It doesn't tell you anything about what's in your pantry, what's in your fridge. It could be your refrigerator could be overflowing or could be completely empty. Right? It doesn't tell you, but that's what's important because that's how much you have stored away, right? As body fat, as sugar in the liver, that's all stored away, but it's all hidden if you're only looking at what's on the table, if you're only looking at the blood glucose, you're not getting any idea of what's over there. And that's what is actually important, is what's stored on your body, because over time, that's what's causing all the damage, right? All that excess sugar that's stored away, causing, fatty liver, fatty pancreas, abdominal obesity, and then all the other stuff.
And this is where conventional medicine really misses the boat, because what they're doing is using these drugs oftentimes, and they're treating the symptom of the high blood glucose. And this can actually cause more issues. If we take the example of injecting insulin, which is, I believe, a further along step of treating type 2 diabetes, that's actually masking the underlying problem and can cause more of an issue over time.
Exactly. So there's, again, you think about the two compartments, the blood glucose and the sort of body glucose, which is the storage, right? Same as you look at, sort of what's on the table and what's in the fridge, right? There's what's in front of you that you can see, and then there's what's put away. So the blood glucose is what you can see. You can measure it, you can see it, but you can't see what's stored away. You don't know how much there is. You can only measure it indirectly through, the abdominal obesity. You can measure how big the liver is, that kind of thing. So for years, because the only thing we could see was the blood glucose, we thought that was the most important thing. And therefore, we should put all our emphasis on lowering this blood glucose. But there's two compartments, right? There's the blood glucose, there's the body glucose, which is the storage. So if you take that blood glucose and you simply shove it into your liver, take all that glucose, shove it into your liver, okay, what's going to happen? Well, your storage compartment is going to increase and your blood glucose is going to decrease. That's what you told the body to do. So if your storage is full, so type 2 diabetes, storage is full, it's overflowing, all this glucose is overflowing out of the body into the blood. Now you take this insulin, this drug, and remember, this is a standard medical practice practiced by every single sort of specialist in the world for the last 40 years. They say, wow, your blood glucose is too high. Your body glucose is also too high, but they're only looking at the blood glucose. So they said, we need to lower it. We can lower it by taking the blood glucose and shoving it back into your liver. It's like, okay, but you haven't fixed the problem, because the problem was that your liver was overflowing. That was the whole problem in the first place. You're basically going to make it worse, because the liver is going to take this glucose that you now shoved into the liver, turn it into fat, right? So you take insulin, you gain weight, because we know that's a main side effect of insulin, because that's what you're telling the body to do. Insulin tells your body to store more glucose. So you gain weight. As you gain weight, what happens to your type 2 diabetes? Well, it gets worse. Then you take more insulin. Then what happens? You gain more weight, which makes your diabetes worse, which makes your blood glucose higher, right? Because think about it. You're taking this glucose, you keep shoving it into this. It's like you have an overfilled balloon. And you keep putting more and more and more into it. It takes more and more effort to fill this balloon that's already overfilled. So you're going to need more and more insulin, just because you've got all this storage which is completely full. You want to jam more into it, you got to use more force. You got to use more insulin, more insulin, more insulin. All the while, everything's blowing up. You're getting bloated, you're gaining weight, and so on. So the whole process, you're making things worse because you never fix the underlying problem. And this is how people treat it. And the doctor said, well, the treatment is correct because the blood glucose is fine. Therefore, this must be just the way the disease is. It's chronic and progressive. Not understanding that their entire treatment paradigm was quite incorrect. In fact, what you should have done was get people to lose weight, not gain weight. If you give drugs that make people gain weight, your diabetes will get worse, right? And patients saw it all the time. They're like, you gave me this insulin, I gained like 30 pounds. And then you gave me more insulin, right? And it's like, how is that making you better? It's like, it's not. What if you use something instead? So if you have too much glucose in the body, there's only two things you want to do to get rid of it. You either put less glucose in, or you let your body burn it off. So if you let your body burn it off, say you use intermittent fasting, or say you use low carbohydrate diet, because that's less glucose, right? You eat other things such as proteins, which are amino acids or fats, but not glucose. So as you do intermittent fasting, for example, because that's the easiest to understand, you're not eating anything. your body's going to need to burn something. It's going to burn glucose. But now what's going to happen is that your blood glucose is going to go down because you're not putting in glucose, and your body's going to need to take glucose out of the storage. So instead of adding more to the storage, you're taking it out of the storage. And over time, as you lose weight, the diabetes get better, which means that you need less drugs.
Well, let's stick on the fasting piece. When it comes to somebody who is overweight or has type 2 diabetes, you mentioned intermittent fasting. There are so many different ways that somebody could do that. Is there one way you found working with clients that's more effective?
Really, they can all work. And because anything that you do, like fasting is simply the sort of opposite of eating. So if you eat, you're storing energy. If you fast, you're using energy, right? So then where do you get the energy from? Well, you get it from your blood glucose, which is blood sugar, or you get it from your body fat, right? Those are the ways you store energy. When you don't eat, those are the ways you use energy. So any of the regimens can work. The most popular would be 16 hours of fasting and 8 hours of eating. So that's the 16-8. One meal a day, which is sort of a 24-hour fast. Those are probably the most popular, but there's nothing to stop you from doing anything sort of less or more. The standard amount of fasting you have to keep in mind. So remember, if you go back to the 70s and the way people used to eat, which is finish dinner by about, say, 6 o'clock and then eat breakfast at, say, 8 o'clock. That's a 14-hour period of fasting that people did every single day without even thinking about it. Okay, 14 hours. That should be your baseline. So now some people say, I'm doing fasting every day. I'm like, how long do you do? They're like 12 hours. I'm like, that's just regular eating, right? It's not, you're not getting nearly enough time for the body to use its energy. So remember, when you eat, you store energy. When you don't eat or when you fast, you use energy. So if you're only giving your body 12 hours, when a normal day should be like 14 hours, you're not giving your body enough time. If you want to lose weight, then you simply push it up. So you can go 16 hours, you can go 18, you can do 20, you can do 24, you can do 30, you can do 36, you can do multiple days, in fact. As you go longer, of course, it's more disruptive to your sort of normal schedule. And you have to be more careful if you're taking medications and so on. In fact, if you're on medications, you really need to talk to your doctor about it in case any of that is affected, because the medications you're prescribed are often with your current diet, adjusted to your current diet. So when you change your diet even, you should really talk to your doctor, because some people go on a low-carb diet and they actually need so much less insulin, for example. So you really can do any of those, but 16-8 and 24-hour fast, which is OMAD or one meal a day, typically work the easiest for most people. So therefore they can implement it the easiest, but there's nothing to stop people from going 2 to 3 days or if they want to.
For somebody who is type 2 diabetic and their body is just super saturated with sugar, they have fatty liver, fatty pancreas, fat distributed throughout the body, how long does that take to start clearing up? If somebody starts doing, say, the odd 24-hour fast or even the 16-8, how long does it take before the liver starts to let go of some of that fat and the body starts to begin to heal?
It's hard to answer that because it all depends on sort of how long you fast for and what your underlying baseline was, right? So if you had a lot of sugar, that might take a long time. If you look at studies of bariatric surgery, so remember, bariatric surgery is where they sort of cut your stomach so that's like the size of a walnut, and then they rewire your intestine so you don't absorb any nutrients. So in essence, it's like fasting. It's just sort of surgically enforced. You can take somebody who is a very severe diabetic and if you put them on a fast, like, bariatric surgery, which is like fasting for multiple days at a time, many of them within like 3 weeks, 2 weeks, will actually go to zero, and like they'll get off all their insulin. So it can be very rapid. If you are just doing the shorter ones, which of course give you a bit more of a controlled, drop, it can still be very fast, like within a few months, but sometimes it can take longer. It depends on how long you're fasting for and what you're eating sort of in between. If you're taking one meal a day, but that one meal is full of, processed carbohydrates, then you're undoing a lot of the good that you did. So you want to stick to a proper diet, the fasting, but it can be very rapid. I mean, I did a case series of a few people who they just implemented a 24-hour fasting period. They were all on insulin, and within a month, all three of them were off of all their insulin, and they'd been on the insulin for like 20 years, right? So 20 years, they got off in a month, right? With 3 days a week of 24-hour fasting. So now that's sort of on the optimistic side. Most people won't get those good results, but on the other hand, if you do it, you can do extremely well. It can reverse actually very quickly, which is, very encouraging.
Let's talk about this from a basal metabolic rate standpoint. So traditionally, people have been taught you want to lose weight, you want to increase your exercise, cut your calories. So let's talk about basal metabolic rate in that case versus fasting. And start off by talking about what basal metabolic rate is.
So basal metabolic rate is the energy that you use sort of at rest. So this does not include exercise, because exercise is your skeletal muscles, right? You run, you use your muscles use energy. So that's great. In fact, exercise is very good for you. However, if you look at the entire day, you generally need a lot more calories for your heart and your lung and your brain and all that sort of stuff. So a lot of people are burning somewhere around, say, 1,800 to 2,400 calories per day, even at rest. When people do exercise, again, it depends on how intensive the exercise is. But, for older people, say they do a little walk around, for 40 minutes or so, it's like 110 calories or something. So you see that the magnitude is far off. So even if you exercise every day, and again, I'm not talking about the people who do a marathon, right? You're burning way more calories. But for the sort of average person who's just doing sort of a bit of modest exercise, it's like 100, 200, 300 calories. And if you ever gone to a treadmill and looked at that, the calories burned scale, you'll know it goes very slowly. And remember, that's because when you exercise, you're only using your skeletal muscles. So that's only one small part that's increasing. Your liver is not using more calories when you exercise, right? Your brain is not. So out of all of your body, the exercise only increases the energy requirements of that one compartment, skeletal muscle. Not your lungs, not your liver, not your kidney, not your bowels, not your brain. They're not using more energy. So that's why there's such a modest increase in energy expenditure with exercise. Now, the thing is that, 2,000 calories a day versus that extra sort of 100, 200, 300, you see that most of the energy, that's why exercise is just a very inefficient way to sort of lose weight, and it's, and take care of type 2 diabetes. If you simply don't eat for one day, you're going to use 2,000 calories because that's going to have to come out of storage, as opposed to if you're eating regularly and exercising, where you're just using an extra 200. So if the fasting is sort of like much more effective than that, because you're really letting your whole body use the energy that's taken out of storage. And remember, if you're overweight, if you have high blood glucose, your body has too much energy. It's just a matter of letting your body use it. So if you're using 2,000 calories, your body fat stores might have 100 or 200,000 calories sitting in it. So is it going to matter? No, not really, as long as you do it properly. The basal metabolic rate does tend to go down as you lose weight, but the other thing is that fasting tends to preserve it better than a simple calorie restriction, because you get these other hormones that go up, such as sympathetic nervous system and so on, which will increase your basal metabolic rate. So that's why exercise is not that important. The fasting in particular might be more beneficial in terms of basal metabolic rate, which is why in the long term it may be more effective as a sort of strategy for weight loss.
When it comes to the exercise piece, when you're working with clients, you talked about exercise as a whole there, but what do you think about using, say, a 20-minute walk after a meal to help bring that blood glucose down?
That's actually a great way to do it, actually. So going for a walk after a meal, because what you're doing, of course, is that you're allowing the body to use the glucose that's easily available. So you're not going to get the same spikes, because as you walk, your muscles are going to need to use some glucose, and you're at that moment in time, the glucose that you're going to use is from the food. So it's not going to go into storage that you're going to need to take it back out. It's just going to get used. So going for a walk right after a meal we have good studies now that show that that's actually a really good way to lower that sort of spike in glucose after a meal. So it is quite effective. I mean, there are other ways to work it in too. So the other one that people use a lot is sort of training in the fasted state, which is where you fast and then you exercise and then you eat, which is again sort of a good way to do things if that's what you like to do. But walking after a meal, some low exercise, because you can't obviously do intensive exercise after a meal because it's very difficult to do that. But so some low intensity exercise is well is well placed to do right after.
Let's get into the details of the dietary piece. So somebody is going to start including fasting, maybe walking after meals when possible. If they want to go low carb, high fat, how hard do they have to push that?
I think that it's, low carb is one thing. It's everything sort of works. So they're just like different levers, right? So you can change the diet. You can lower the amount of carbohydrates, for example. That's one way that you can affect things. But there's other ways to do it. You can also change the carbohydrates to unprocessed carbohydrates. So that's going to change something completely different. You can use intermittent fasting, which is completely different, where you don't eat at all. So you can change your diet, you can change the fasting periods, you can change the exercise. When you're talking about the dietary piece, there's obviously a lot of discussion. Like there's always a lot of debate about that. But to me, it's like that's only one part of it, right? You're arguing about the diet, but people haven't looked at the fasting period, which is an entirely different aspect of it. Exercise, we all agree on. Everybody knows, everybody agrees exercise is very good for you. But the dietary piece, you can make it work because whether you're, low carb or low fat or keto or paleo or whatever, you can generally make it work as long as you're eating sort of unprocessed food. So people who eat a whole food plant-based diet, you can do very well with that, because again, when you're eating whole foods, it's different. What was dangerous was not necessarily the carbohydrates, because people have been eating carbohydrates for a long time, but it's that highly refined carbohydrate where you're getting that huge spike up and spike down. If you're just eating beans, for example, and you're just getting sort of a slow rise in glucose and then a slow drop, well, you've got tons of fiber, you're getting filled up, you're activating your satiety hormones through stretch receptors. Well, that's not so bad for you. Like there's nothing to really be afraid of from that standpoint. But it's the sort of refined stuff, that quick rise and quick drop. That's why, a lot of times we focus on the macronutrients, like carbs are bad or fat is bad or, proteins are good. But really, we shouldn't be thinking about things like that. We should be thinking about sort of foods instead of nutrients, because certain foods, even if they're the same carbohydrates, are metabolized very differently. So if you're eating white bread versus beans, there's a huge difference. You just have to look at like the glycemic index of white bread versus beans. So the glycemic index is this index of how high your glucose goes up per 50 grams or 100 grams of carbohydrate. So when you eat those two foods, both have the same amount of carbohydrate, your body responds quite differently. White bread goes way up, beans don't. Still carbohydrate. So the whole idea of just counting carbs, it captures one aspect of the diet, but not all of it. So that's why, so some people who don't want to push it, well, the main thing to push is make sure you're eating sort of whole foods, because if you're eating whole foods, you're generally going to be okay. Unprocessed foods, you're generally going to be okay. Because people used to think, well, if I'm vegetarian, I'm going to be healthy. No, you could eat, pizza, French fries, and chocolate donuts all day long and be completely vegetarian. It's not healthy. Nobody thinks that is healthy, ever, right? And that's why people are like, oh, it's now whole food vegetarian or whole food plant based. And I think that's much healthier because you're acknowledging that, there's a big difference between eating salads all day long and eating French fries all day long or eating chocolate donuts all day long. Like that's vegetarian too, but not healthy. It's not that it's plant or meat is what makes it healthy. It's is it whole food or not? And that's the same with carbohydrates too. So you don't necessarily have to push it that hard to be low carb, but you really have to push the sort of unprocessed foods more than anything else.
I like how you refer to these tools as levers. And I think it's going to come down to the individual case for the person, how many levers they want to pull at once. So, going ketogenic or really low carb for somebody that is type 2 diabetic, that might be where they want to go because they've gone so far down the continuum versus somebody who's just maybe in the obesity part of the continuum. So I think each person needs to consider where they're at, how fast they want to regain their health when considering all these different tools or levers that we're talking about.
Exactly. And everybody responds differently too, because you can put two people on the same diet. So all the dietary studies show this, right? So you compare, say, two diets, low carb versus low fat. On general, low carb does a bit better in terms of weight loss. But when you look at the splay, it's huge. So some people on the low fat diet do very well and some people do very badly. Same as the low carb. So you can give them the same diet, but each person will respond very differently. And that's why people get into these huge arguments, especially on Twitter, where they're like, "Oh, it's all about calories because it's all about carbs. It's all about this." It's like that's because that's their experience, which is valid for them, but not necessarily valid for somebody else. It makes no sense when we know that everybody responds so differently to these different diets to say this is the diet for you, right? It's like you need to try it and see what works, but there are some general principles like cutting out sugar, cutting out refined foods, that are going to be universal. Make sure you have these diets wars that go on are sort of tiresome because you have all these people who say that this worked for me and therefore it's great, but it may not work for the next guy, right? It simply makes no sense. It's like somebody who loves sushi who's insisting that, it's so great, but the next guy who hates sushi, or the one guy who loves coriander and the next guy who hates coriander, trying to convince the other that, coriander is the best, coriander is where. Why argue? Like you like it and you don't. Same thing for diets, right? You responded to it, but you didn't. So therefore, this person who didn't respond needs to find something else that does better. Doesn't mean that the person who did respond was wrong, right? That's the argument that always goes on, especially like, oh, low fat, whole food, plant-based, paleo, this, that. Like it worked for you. That's all you can say. It may or may not work for the next guy. The next guy is going to have to figure out what works for them. But the general principles, as I said, are probably universal. On those, we probably don't disagree that much. Cutting out sugar is one of the main principles. Cutting out refined foods is another main principle. I don't think anybody disagrees on. Exercise is good, but inefficient for weight loss. That's, pretty true as well. And then the fourth one, which I've always harped on, which hadn't been sort of touched on for a long time, was make sure you're not eating all the time. Because prior to me talking about it, honestly, the conventional wisdom was eat all the time to lose weight. Like, does that even make any sense? How can you eat to lose weight? You can only really lose weight when you're not eating. So why would you eat all the time? Like, it is completely nonsensical. It came out of that whole sort of low-fat hysteria, right? But whether you're low-fat or low-carb or high-protein or low-protein or plant-based or non-plant-based, that one you actually have to figure out for yourself because there actually is a huge inter-individual variation between the two. The general principles you can keep the same, but the specifics of the diet you have to work out a little bit for yourself because, everybody's a little bit different here.
So to highlight the tools, somebody right now who is obese or has type 2 diabetes, fasting, that's the biggest one we want to consider and implement. Low carb, high fat diet, possibly including a walk after meals to keep that blood sugar low. or possibly including exercise during the fasting window. I would say those are the big ones for people to consider. And with those tools, they're going to be able to start to expel all that extra sugar in their body. And wherever they are along that continuum from obesity, prediabetes, diabetes, they're going to start to come down the other way. And I want to highlight something you mentioned before too, where for people that are on medication, you need to consult with your doctor, because you're going to be radically changing the physiology in the body when you start to implement these tools. And we need to be safe and make sure we're doing this in a healthy way. So, Jason, before we part ways, any other tools you'd add to that for people to begin their journey?
No, I think that's it. And, for those people who want to consider something like a glucose monitor, it has been a very useful tool for people, because remember, it's about, if you're worried about your blood glucose, there's nothing better than getting sort of real-time information on your blood glucose. Because if your blood glucose is high and you're not that hungry, you might just decide, oh, I'm just going to skip lunch because I have plenty of energy. So I have plenty of glucose, let myself burn it off, right? So that's another sort of useful tool technology that's been available. So I work with a company called Level 2, which is trying to use this for type 2 diabetes, right? And this basic principle is sort of, if you measure it, then you're going to know what to do. And that's very useful. So now we have this technology. We should use it because a lot of people have known it, but it's kind of expensive. That's the only issue.
I agree. It's great. And Jason, we're going to link up the books. We're going to link up your social media, your website, everything in the show notes. This has been a pleasure again. Thanks for coming back on the show.
Thank you so much, Jesse.
Now that you're done watching my conversation with Jason, click here and catch my chat with Dave, where you're going to learn even more about fasting and all about upgrading your diet and lifestyle. I'll see you over there.
And that's why I'm absolutely convinced I'm going to live to at least 180. That's why I know anyone listening to this can raise their IQ by 10 points, because it's not that